Welcome to Dr. Smell-Bell-Verbal for ENT from Hyderabad, India, about the Smell-Bell-Verbal pranayama artery, that is Eka Naasika Bhasthrika pranayama. Eka Naasika Bhasthrika pranayama is all about doing inhalation and exhalation through the nose, that is single nostril. Eka means single, Naasika means nose. Bhastrika pranayama, it will be helpful in improving your nasal openings and then also upper part of your chest, and relaxation comes as it is. I, being an ENT surgeon, I would like to say about the physiology of your nose. How many of you people, all of you know, who knows about the nose, that one of the nostril is always more active and the other nostril is less active. This is the physiological situation that occurs during the respiration, so that to keep the other nose into a rest, and it will help in maintaining the nasal cycle, so that other nose will be a bit inactive and one nose is more active. As far as the yogic understanding is concerned, the right nose is supposed to be the sun and left nose is supposed to be the moon. If you are taking breath voluntarily on the right nose, your heat process increases in your body. And if the left one, if you are taking the nostril as a breathing agent, you will have the cold process that is occurring in the body, that is all about the moon on the left and then the sun on the right. Pardon me if you are seeing the video in an inverted manner. So what happens in this is that you should be having a thorough understanding of this nasal physiology, that you're letting one of the nose to function properly, so that you can ease the stress and also you can drive away the whatever is the excessive accumulation of gases that is present voluntarily. With the help of this, what you would achieve is that you can have a good respiration through the nose, and also the lung hygiene is maintained, especially in a period like COVID. People are looking at the alternate modes of getting the improvement of the immune system and also boost up of your body's mechanism by means of yoga. This will be very much useful when you're seeing this one. So what you should supposed to be doing is that this is the dhyana mudra, as I've been telling you people about the dhyana mudra. So this is about the dhyana mudra, and as yesterday I was speaking about your, this is the Agni and this is the Surya, this is the Prithvi. You're trying to compress it like this is yesterday's yoga video. But today we are going to see that how you have to use this. You have to compress these two fingers, flex these two fingers. Anuloma Viloma, how would you try to do it? The right side you use the thumb like this, and left side you use these two fingers like this. And see that you are away from most of your family members. Why? Because you need to get away from all the particles that are coming from your nose that might infect your family members. So please stay away when you're doing that, but don't do it outside like in front of a lake or on the seashore or anywhere outside on the top of the building in the early in the mornings. Why? Because the cold air enters inside you, then it sucks out all the warmth that is present in your respiration. Once it sucks out all the warmth in your respiration, what is supposed to do is you get cooled down. There is no amount of warmth for you people, so that it's a useless thing that if you're doing that. Or instead you be in a closed rooms. Old and ancient Indians, they used to practice this, that is the sages and the rishis are used to practice this type of yoga within the caves, because Himalayan area there is a lot of cold. In the case of cold months, they used to go inside the caves and they used to do these type of practices. This is how it's understood from the yogic literature. So in this way, we are going to start this Eka Naasika Bhasthrika pranayama. First, let us do some amount of warm up. You can just sit up in the Sukhasana like this. Like you can fold one of your legs like this on your this is semi Padmasana, or you can just see in the Sukhasana also, and your hand should be in the dhyana mudra. Initially do dhyana with the help of Omkara. Chant Omkara in your mind or whatever mantra. If you're believing in your own Lord, you can just chant that mantra. This is a method of getting the concentration. Why? Because the known things we tend to concentrate a bit more. So I'm trying to do that initially, starting chanting with Omkara. Trying to ease myself, relax myself. Later on, I'll try to do the warm up for the shoulders. Shoulders, when you're trying to do this clockwise and 5 times anti-clockwise, so that you get relaxed with your muscles, and then you get a warm up with this, and then you will be feeling comfortable by doing that. Later on, you try to put the left hand in this dhyana mudra. On the left hand, I am putting it here. You're not able to see on, but I'm putting it on the left side knee joint, and you could see here. And the right hand, as I already told you, you have to bend these two things. I'll try to close the right side nostril and try to sniff in deeply and then exhale deeply with the help of this nostril only, not in the mouth. You're going to do it through the nostril only. So inside and outside for almost, I'll try to count it for 50 times. Let me do that once. After you do this, you try to be in the relaxation pose for almost 1 minute and relax yourself. Your spine should be straight, and you're in the hemi Padmasana, half of the Padmasana, Ardha Padmasana. And once again, and taking these two fingers, folding like this, you're using these two, the ring finger and the little finger. You're trying to block the left side and try to take deep breath the same number of times as you did on the left side. You could see that right nose is blocked for me, therefore I'm not able to talk. Well, left nose I'm able to open it. So I'm doing the same thing. Like when you're seeing that, so once again come back into the Dhyana Mudra, wherein you are going to do it for almost 1 more minute to relax yourself. After doing this, you can just open your eyes and feel the difference that you are able to perceive in your mind, and also your breathe. Both will be improved, and you feel happy at the upper part of the chest, and you could feel the cold that is present in the throat. Both of the pyriform fossa, you can feel that. I could feel it like that. Ardha Padmasana, you are going to be like that, and then like with this you are going to perceive all of your relaxation. So by this way, Eka Naasika Bhasthrika pranayama came into an end. And let me tell you the contraindications for these things. If you're going to do this after a ear surgery, it's a wrong thing. Don't do this after a cataract, and don't do this for any cardiac problem. Not everybody is supposed to do all this pranayama. If you're a real patient, you have to ask your consultant specialist doctor whether you can do it or not. So with this, I conclude this Eka Naasika Bhasthrika pranayama. Yoga is an Indian way of lifestyle which will help us to unify the body, mind, and soul. Is a base of the Sanatana Dharma that has been preached in this country for long more than 5,000 years and practiced by most of the yogis and rishis who were living happily along with this without any problem. This modern lifestyle requires this yoga only for the fact that to control the particular amount of stress that you have, the anxiety that you have, and the way that your body is getting exposed to the pollution, you can just get away with these basic techniques and pursue a happy health. I hope you are following Dr. Smell-Bell-Verbal yoga artery for replenishing your mental thought process, which is very much important, especially the exercise which I told you is most commonly about the nose problems. You will have a very good relief for the nose problems, and you can get relief from this particular nasal block and upper part of chest congestion, and also getting away from the driving the mucus away. Some of the contraindications are to be followed by the patients who are meeting the doctors regularly. Thank you very much for watching Dr. Smell-Bell-Verbal Yoga and Pranayama Artery. Dr. Smell-Bell-Verbal ENT surgeon from Hyderabad, India. I hope you're liking the videos. I hope you are subscribing our channel. Dr. Smell-Bell-Verbal Chandrasekhar from Hyderabad, India. Namaste.